Hello again from Dartmouth-Hitchcock. I'm Ed Marins, the Chief Clinical Officer. And with me again today is Antonia Altomari, our clinical epidemiologist and infectious disease expert, here to address some of your questions and talk about some updates about where we are with the COVID-19 infection and issues facing Dartmouth-Hitchcock and really the nation. So just some updates from us. Really, no news is good news, and we have no new positive cases that have been announced by the state. We've been working very closely with the state and feel very confident in the measures that we've taken to protect our patients, and our staff have been really quite good. We continue to stay in touch with all our patients and have been working to ensure that everyone's doing well. The contact with the state has really been quite excellent. The state has been very open and collaborative with us. We've talked a lot about testing, and they've done a great job of obtaining additional tests and have been great partners as we begin to think about kind of what's being said at the state level and what's being experienced at the care level that we have some experience with now. I want to give a little update on our partners at Southwest Vermont Medical Center, who are managing the only inpatient really in northern New England, and are doing an incredible job. As you know, we have a relationship with Southwest Vermont. We deliver telehealth services in collaboration with them, as we do in many hospitals across the system, and this has been a big part of their care delivery, and we feel really proud about this service and this collaboration in clinical care. I want to talk a little bit about where we are with testing. We continue to work very closely with the state, who does all the formal testing in collaboration with our teams here after we've identified cases that we think warrant testing. We've also talked in some of our presentations about developing the coronavirus testing here at Dartmouth-Hitchcock, and we're currently working on this in collaboration with the state, who has provided us the RNA, or the genetic material from the virus, to be able to do some validation testing that is currently underway. We think it's going to take a couple more days, and may even be longer than that, for us to get everything set. But at this point, we still have the ability to test patients through the state on an as-needed basis. I want to talk a little bit about our preparations here, and I'll have Antonia talk a little bit about some of the protective gear that we wear, but we are completely prepared for patients if they need hospital-based care. I think if you come here now for an appointment or any other kind of care, you will not find a hospital with a bunch of people with gowns and gloves and masks. But if you do require a higher level of care because we feel that you've been exposed or you have the right symptoms, you'll be greeted, and we have measures in place to take care of people, and the people that will take care of you will have a certain amount of protective equipment. I want to have Antonia talk a little bit about what does protective equipment look like as we begin to look at new guidelines from the CDC and measures we're developing here.
So as we said before, we have a very reliable system to be able to identify and properly isolate anyone who's coming in with suspect symptoms consistent with COVID-19. So in the event that a patient screens positive by way of asking the 3 questions we've mentioned, that is travel to a high-risk area, exposure to a suspect or confirmed patient or person with COVID-19, or symptoms consistent with it, you will see that healthcare providers will have on the necessary personal protective equipment that would prevent the spread of disease. And that would be some kind of protective equipment over the nose and mouth, as well as the eyes, and a gown and gloves. And this is all recommended by the CDC to prevent transmission of COVID-19.
I think it's really important. We're training our staff, our nurses, and a whole range of team members to be totally protected in these environments, and this is a big part of our effort going forward. But across our system, people should know that people are being trained in personal protective equipment, and there will be similar gowning, gloving, mask, and face shields as needed to care for these patients. We should also talk about the main thing we can do to prevent this virus, which is hand washing. We know many people are worried about the limitations of resources as it relates to alcohol-based sanitizers. We do recommend an alcohol-based sanitizer with 60% or more alcohol as part of its formula. But if you don't have access to that, what about regular hand washing?
So regular soap and water is just as good. Just remember that you should rub your hands together under the water with the soap for at least 20 seconds to be effective. And then almost as important as that is drying. So hands need to be thoroughly dried. So even if there is a shortage of Purell or alcohol-based hand rub, know that soap and water is always just as effective.
All right. Well, that's the update from Dartmouth-Hitchcock from Antonia and myself. Just want to remind everybody there are a number of ways to contact us here at Dartmouth-Hitchcock. We have an email address, we have a hotline, and you can always get us at dh.org. We'll respond to your questions and come back with some more updates soon. Thanks again.